Have you ever wondered what really happens to your prostate when you masturbate after 60? Many men don't realize that each time they engage in sexual activity, their prostate undergoes a series of changes, some of which can be beneficial, while others might raise concerns if overlooked. Understanding these changes can help you make more informed decisions about your health and well-being as you age. In this discussion, we will explore 6 key changes that masturbation can cause in the prostate, ranging from hormonal shifts to potential impacts on long-term prostate health. If you believe that staying informed about your health can make a difference in your quality of life, take a moment to subscribe to Graceful Elderly and share this important message with others. Knowing more about how your body functions can empower you to take better care of yourself and maintain your well-being. Let's begin with the first change: impact on prostate cancer risk, one of the most debated topics regarding masturbation and prostate health is its potential role in reducing the risk of prostate cancer. Over the years, various studies have suggested that regular ejaculation may help flush out carcinogens and inflammatory agents from the prostate, potentially lowering the risk of developing prostate cancer later in life. The reasoning is quite straightforward. The prostate produces seminal fluid, and over time, it can accumulate toxins, metabolic byproducts, and excess hormones. If these substances are not regularly expelled, they might contribute to cellular damage and inflammation, both of which are linked to an increased cancer risk. For instance, a study conducted by Harvard researchers found that men who ejaculated at least 21 times per month had a significantly lower risk of prostate cancer compared to those who did so less frequently. While this does not imply that every man needs to meet a specific frequency, it does indicate that maintaining a regular pattern of ejaculation could be beneficial for prostate health. However, it's essential to remember that genetics, lifestyle, diet, and overall health also play significant roles in determining cancer risk. Take James, a 74-year-old man with a family history of prostate cancer. Concerned about his risk, he began researching ways to support his prostate health. After consulting his doctor, he learned that maintaining an active sex life, coupled with proper nutrition and regular checkups, could help reduce his overall risk. He made simple changes like including more cruciferous vegetables in his diet, exercising regularly, and ensuring more frequent ejaculation. Over time, he noticed improvements in his energy levels and a sense of confidence regarding his health. However, it's crucial to understand that ejaculation alone is not a guaranteed way to prevent prostate cancer. It should be seen as one of many lifestyle factors that contribute to better prostate health. Maintaining a healthy diet, reducing stress, staying physically active, and getting regular prostate screenings are equally important. Next, let's discuss the temporary reduction in prostate congestion. One of the lesser-known benefits of masturbation is its ability to relieve prostate congestion. When seminal fluid builds up in the prostate without being released, it can cause a feeling of fullness, discomfort, or even mild pelvic pain. This is particularly true for men who do not ejaculate regularly. The process of ejaculation helps release this buildup, reducing internal pressure and potentially lowering the risk of discomfort and inflammation. This concept, often referred to as prostatic drainage, is particularly relevant for men with benign prostatic hyperplasia (BPH) or chronic prostatitis, where stagnant fluid can lead to inflammation and urinary issues. For most men, regular ejaculation results in a feeling of relief and relaxation. However, for those who abstain for extended periods, the accumulation of fluid can cause discomfort or an increased urge to urinate. Consider Richard, a 72-year-old retiree who had not been sexually active for several months. He began to notice a dull ache in his lower abdomen and more frequent nighttime urination. After visiting his doctor, he was informed that his symptoms were due to mild prostate congestion. His doctor recommended that moderate ejaculation might help alleviate the pressure and reduce his symptoms. After following this advice, Richard experienced a noticeable decrease in discomfort and fewer nighttime trips to the bathroom. This doesn't mean that all men need to maintain a specific frequency of ejaculation, but it does highlight that moderate sexual activity can serve as a natural way to maintain prostate health. However, if discomfort persists even after ejaculation or the relief is short-lived, it might indicate an underlying issue that requires medical attention. Next on the list is the hormonal shift in testosterone regulation. When you masturbate, your body experiences temporary fluctuations in hormone levels, particularly testosterone and dihydrotestosterone DHT. These hormones are crucial for prostate function, muscle strength, and overall male health. Typically, testosterone levels may drop slightly immediately after ejaculation. For younger men, this dip is often imperceptible because their bodies quickly replenish testosterone. However, as men age, testosterone production naturally declines, and frequent ejaculation can sometimes lead to short-lived dips in energy or motivation. For some older men, this decrease might be more noticeable, manifesting as fatigue or reduced muscle recovery. However, it is generally a short-term effect, with hormone levels typically returning to normal within 24 hours. There is also the consideration of DHT, a more potent form of testosterone linked to prostate health. While moderate ejaculation might help reduce DHT buildup, which is associated with prostate enlargement. Too little DHT can affect libido and overall vitality. Frank, a 68-year-old who noticed decreased energy after frequent masturbation, consulted his doctor and learned that balancing his activity level with proper sleep, strength training, and a nutrient-rich diet helped him maintain a healthier hormonal balance. This holistic approach allowed him to enjoy a normal sex life without experiencing prolonged fatigue. While these hormonal changes are not inherently harmful, being mindful of how your body responds to sexual activity can help you make more balanced choices. Masturbation itself is not damaging, but moderation is essential, especially for older men who may already experience hormonal fluctuations. Understanding these changes allows you to approach your health with greater awareness. Regular ejaculation can be beneficial for prostate health, but it is essential to maintain a balanced lifestyle that includes proper diet, exercise, and medical checkups. Another significant aspect of understanding the impact of masturbation on prostate health is its effect on blood circulation. As men age, maintaining proper blood flow to the pelvic region becomes increasingly important. Poor circulation can contribute to issues like erectile dysfunction, pelvic pain, and even increased risk of prostate-related disorders. Engaging in regular sexual activity, including masturbation, can stimulate blood flow to the prostate and surrounding tissues, which may support overall prostate function. During sexual arousal and ejaculation, the pelvic muscles contract and blood rushes to the genital area. This increased circulation not only enhances arousal, but also helps oxygenate the prostate and flush out metabolic waste that could otherwise accumulate. For older men, this can be particularly beneficial as sedentary lifestyles and reduced physical activity might decrease natural blood flow to the lower body. An important consideration is that ejaculatory contractions act as a form of exercise for the pelvic floor muscles. These muscles support the bladder, bowel, and reproductive organs, playing a key role in urinary control and sexual function. Regular use helps maintain muscle tone, which may reduce the risk of urinary incontinence and support stronger, more controlled urination. Take George, a 70-year-old who noticed mild incontinence and weaker urine flow over the past few years. After consulting with a specialist, he learned that part of his issue stemmed from weakened pelvic floor muscles. Incorporating pelvic floor exercises, such as Kegels, along with moderate masturbation, helped him improve muscle tone and reduce urinary leaks. His experience highlights how maintaining pelvic circulation and muscle engagement can contribute positively to prostate health. However, it's crucial to approach this balance with care. Excessive ejaculation, particularly in older men, may temporarily deplete energy levels and lead to pelvic soreness. If you notice discomfort or prolonged fatigue after sexual activity, it might indicate that your body needs more recovery time between sessions. Listening to your body and moderating frequency based on personal comfort is key. Next, let's discuss how masturbation can impact urinary function. One of the challenges many men face as they age is an increased frequency of urination or difficulty fully emptying the bladder. The prostate plays a direct role in this process because it surrounds the urethra. As the prostate enlarges, a common condition known as benign prostatic hyperplasia (BPH, it can compress the urethra, leading to weak urine flow, straining during urination, and a sensation of incomplete emptying. Masturbation can provide temporary relief for some of these symptoms by helping reduce prostate congestion. During ejaculation, the prostate contracts, pushing out seminal fluid. This natural contraction can alleviate internal pressure, which might otherwise contribute to urinary difficulties. Men with mild BPH often report feeling more comfortable after ejaculation, as the act helps clear the ducts and reduces temporary swelling. For example, Mark, a 66-year-old dealing with mild BPH, noticed that his urinary flow improved slightly after sexual activity. Although this effect was not long-lasting, it provided temporary relief, particularly during periods when his symptoms were more pronounced. His doctor explained that while masturbation is not a cure for BPH, it can help mitigate congestion and improve comfort in the short term. It's essential to understand that while ejaculation might reduce symptoms temporarily, it does not address the underlying cause of prostate enlargement. If urinary difficulties persist, seeking medical evaluation is necessary to rule out more serious conditions, such as prostatitis or prostate cancer. Another aspect to consider is how hydration and sexual activity interact. Dehydration can lead to more concentrated urine, which may irritate the bladder and prostate. Therefore, staying well hydrated is crucial, especially when engaging in regular masturbation. Drinking plenty of water helps flush the urinary tract and reduce the risk of urinary tract infections (UTIs), which can become more common as prostate health declines. The next change to consider is the mental and emotional benefits of masturbation, which indirectly support prostate health. Stress and anxiety are known contributors to prostate issues, as chronic stress can lead to elevated cortisol levels and inflammation throughout the body. Engaging in sexual activity can stimulate the release of endorphins, dopamine, and oxytocin hormones that promote relaxation and reduce stress. For many older men, masturbation becomes a form of stress relief. The rhythmic, repetitive motion combined with the pleasurable outcome can serve as a natural way to unwind, especially during periods of heightened anxiety. This stress reduction not only benefits mental well-being, but may also positively influence physical health by lowering systemic inflammation. However, it's important to differentiate between healthy sexual habits and compulsive behavior. While moderate masturbation can relieve stress and support prostate health, excessive or compulsive masturbation might indicate underlying issues, such as loneliness or emotional distress. Maintaining a balanced approach ensures that the practice remains beneficial rather than detrimental. One psychological benefit of masturbation for older men is that it helps maintain a sense of normalcy and masculinity. Aging often brings changes to sexual function, and reduced libido can feel disheartening. Regular, moderate sexual activity, including masturbation, can help men maintain a positive relationship with their sexuality and combat feelings of inadequacy or frustration related to aging. Sam, a 72-year-old widower, found that maintaining a healthy masturbation routine helped him feel more connected to his own body. After his wife passed away, he struggled with loneliness and a sense of loss. Reclaiming his sexuality in a private, respectful way gave him a sense of control and reduced his feelings of isolation. This highlights how intimacy with oneself can be a valuable part of self-care during later years. It's also worth noting that engaging in masturbation can help preserve erectile function. The old adage, use it or lose it, holds some truth when it comes to maintaining blood flow and muscle function in the genital area. Men who continue to experience erections, even if not during partnered sex, may preserve better vascular health. In the region, regular arousal encourages blood vessel flexibility and helps prevent erectile dysfunction related to disuse. Overall, maintaining a balanced, healthy approach to masturbation as one ages can support both physical and emotional well-being. While it may not solve all prostate-related issues, it can contribute positively to circulation, stress reduction, and maintaining a sense of vitality. Monitoring your body's response and adjusting frequency according to comfort are crucial to ensuring that this practice remains a beneficial part of your routine. While masturbation can offer physical and emotional benefits for older men, it's essential to address some of the potential risks and common misconceptions that surround this topic. As with any aspect of health, moderation and self-awareness are key. Understanding when masturbation might become problematic or when it could indicate an underlying health issue helps ensure that this practice remains a positive part of aging. One of the most significant misconceptions is that frequent masturbation weakens the prostate or causes health decline. This belief is rooted more in myth than in scientific evidence. In reality, moderate masturbation does not harm the prostate. In fact, as discussed earlier, it may help reduce the risk of prostate congestion and support circulation. However, excessive masturbation can lead to temporary issues like soreness or fatigue, particularly if the body is not given adequate time to recover. For instance, older men might notice pelvic discomfort or mild swelling if they engage in multiple sessions within a short period. This can be attributed to overuse of the pelvic muscles and tissues, leading to temporary inflammation or tenderness. While this is usually not harmful, it can become uncomfortable. Taking breaks and allowing the body to recuperate helps prevent these issues. Another misconception is that masturbation decreases testosterone levels over the long term. While it is true that testosterone can temporarily dip after ejaculation, this effect is short-lived and does not lead to a lasting decline in hormone levels. The body naturally regulates testosterone production, and regular ejaculation does not cause a permanent reduction. In fact, some studies suggest that sexual activity may help maintain healthy testosterone levels as the body's reproductive system remains active and engaged. It's also important to address the concern that masturbation causes erectile dysfunction, ED. On the contrary, moderate masturbation may actually help preserve erectile function by maintaining blood flow and keeping the penile tissues responsive. Problems arise only when masturbation becomes compulsive or if it leads to desensitization, where men find it more challenging to achieve arousal or satisfaction with a partner. Take Peter. A 68-year-old who became worried when he noticed difficulty maintaining erections during intimacy with his wife. He admitted to regularly watching adult content and relying on self-stimulation more frequently than before. His doctor explained that his brain had become conditioned to specific visual and physical stimuli, making partner intimacy feel less stimulating. By reducing his solo activity and focusing on reconnecting with his spouse, Peter gradually restored his responsiveness during partnered sex. This highlights how compulsive masturbation or over-reliance on specific stimuli can potentially disrupt normal sexual function. While masturbation itself does not cause ED, the way it is practiced can sometimes affect sexual dynamics, particularly if it becomes a substitute for intimate connection. A related issue is the emotional impact of guilt or shame associated with masturbation. In many cultures, older adults may feel uncomfortable discussing or even acknowledging their sexuality. Internalized guilt can lead to stress, anxiety, and even avoidance of healthy sexual expression. Addressing these feelings openly, whether through conversation with a healthcare provider or a trusted counselor, can help reduce emotional burdens and promote a healthier relationship with one's sexuality. It's also important to recognize that masturbation should never cause physical harm. Some older men may worry about injury, particularly if they experience discomfort afterward. Generally, soreness or mild irritation from overzealous activity will subside within a few days. However, persistent pain, blood in the semen or urine, or visible swelling could indicate an underlying issue that requires medical attention. Conditions like prostatitis or urethral irritation might be exacerbated by excessive or vigorous masturbation. John, a 70-year-old who noticed blood in his semen after a particularly intense session, became anxious about what this could mean. His doctor reassured him that occasional blood in semen is not uncommon and can result from minor trauma to small blood vessels in the prostate or urethra. After a few days of rest and reduced activity, the symptom resolved. However, because blood in the semen can also indicate infections or prostate issues, it's always best to seek medical advice if it recurs or is accompanied by pain. Another misconception is that masturbation leads to prostate enlargement. While the prostate does enlarge naturally with age, this process is primarily driven by hormonal changes rather than sexual activity. Conditions like benign prostatic hyperplasia, BPH, develop over time and are influenced by factors such as genetics and hormonal shifts, not by how often one ejaculates. Maintaining a balanced approach to sexual activity, along with a healthy lifestyle, is more impactful in managing prostate health than abstaining entirely. A less discussed but equally important consideration is how psychological factors can influence masturbation habits. Feelings of loneliness, boredom, or stress can sometimes lead to increased frequency, especially for older men who live alone. While occasional self-soothing through masturbation is normal, using it as the primary coping mechanism for emotional challenges may indicate the need for broader social support or mental health strategies. For example, Harold, a widower in his 70s, found himself masturbating more frequently after his wife passed away. He initially saw it as a way to manage loneliness, but over time, he felt it was becoming more of a habit than a choice. Speaking with a therapist helped him understand his feelings of loss and find other ways to engage socially and emotionally. Reducing his reliance on masturbation as a coping tool, it's also vital to address the fear that reduced sexual desire with age automatically means something is wrong. As testosterone levels naturally decrease, libido may wane and sexual frequency might decline. This change is entirely normal and does not necessarily indicate a health problem. Some men may choose to masturbate less often, while others maintain regular activity. Both approaches are valid as long as they align with personal comfort and well-being, understanding that masturbation is a natural part of human sexuality at any age, helps remove the stigma, and promotes a healthier perspective. There is no one-size-fits-all. Frequency or approach, as individual preferences and health considerations vary widely. The focus should be on moderation, self-awareness, and maintaining an open dialogue with healthcare providers when needed. Balancing one's sexual habits with physical well-being and emotional health ensures that masturbation remains a positive and stress-relieving practice rather than a source of anxiety or discomfort. By staying informed and attentive to your body's responses, you can continue to enjoy a healthy relationship with your sexuality throughout your later years. While understanding the role of masturbation in prostate health is important, it's equally crucial to focus on a broader approach that supports the prostate through lifestyle choices, nutrition, and proactive health care. As men age, the risk of prostate-related issues like benign prostatic hyperplasia (BPH), prostatitis, and even prostate cancer increases. Taking steps to protect and maintain prostate health can help minimize these risks and enhance overall well-being. One of the most fundamental practices for maintaining prostate health is regular physical activity. Engaging in exercises that promote cardiovascular health, such as brisk walking, swimming, or cycling, helps improve blood circulation to the pelvic region. Enhanced blood flow supports prostate function by reducing inflammation and promoting tissue health. Incorporating pelvic floor exercises, commonly known as Kegels, can also strengthen the muscles surrounding the prostate and bladder, reducing the risk of urinary incontinence. Consider Paul, a 65-year-old who began experiencing mild urinary hesitancy. His doctor recommended incorporating a 30-minute walk into his daily routine along with Kegel exercises. After a few weeks, Paul noticed that his urinary flow improved, and he felt more in control of his bladder. Regular movement helped reduce pelvic tension and maintained muscle strength, contributing positively to his prostate health. Nutrition plays a pivotal role in supporting prostate health as well. Including anti-inflammatory foods in your diet can help reduce the risk of prostate enlargement and irritation. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that support detoxification processes and reduce inflammation. Tomatoes, rich in lycopene, have been associated with a lower risk of prostate cancer due to their antioxidant properties. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, help reduce chronic inflammation. Incorporating these into your weekly meal plan can provide protective benefits for the prostate. Additionally, seeds such as flaxseed and chia seeds are rich in healthy fats and can be easily added to cereals or smoothies. One common dietary mistake among older men is consuming excessive red and processed meats, which have been linked to increased inflammation and a higher risk of prostate issues. Opting for lean protein sources, such as chicken, turkey, tofu, and legumes, can support prostate health without contributing to unnecessary inflammation. Another vital component is hydration. Drinking plenty of water helps flush out the urinary system, reducing the concentration of irritants that might accumulate in the bladder and prostate. However, it's wise to limit fluid intake before bedtime to reduce nighttime urination, a common issue for men with BPH. Herbal teas like green tea and nettle tea can also provide antioxidant benefits while supporting urinary function. Managing weight and blood sugar levels is also essential. Obesity and diabetes have been linked to a higher risk of prostate enlargement and dysfunction. Maintaining a balanced diet rich in fiber, whole grains, and vegetables not only supports digestive health, but also aids in regulating blood sugar. Reducing refined carbohydrates and sugary snacks can prevent insulin resistance, which indirectly benefits the prostate. Equally important is maintaining hormonal balance. As testosterone levels naturally decline with age, estrogen levels can relatively increase, influencing prostate growth. Maintaining a healthy weight and staying physically active helps balance hormone levels, reducing the likelihood of hormonal imbalances that might affect prostate size. Stress management is another crucial factor, as chronic stress can contribute to inflammation and impact hormone levels. Practices such as meditation, deep breathing exercises, and yoga not only support mental well-being, but also help reduce systemic inflammation. Lowering stress levels can prevent spikes in cortisol, a hormone linked to inflammation and immune system suppression. Routine medical checkups are vital for detecting potential prostate issues early. Annual prostate exams, including the prostate-specific antigen PSA test and digital rectal examination DRE, can help monitor prostate size and detect abnormalities. Early detection of prostate cancer or other conditions increases the chances of successful treatment and better outcomes. Men should also be mindful of urinary health, as frequent urination, nocturia, excessive urination at night, or difficulty starting the urine stream could indicate prostate enlargement. Addressing these symptoms early with a healthcare professional helps identify whether lifestyle changes or medical interventions are necessary. Another proactive approach is taking prostate supportive supplements after discussing them with your healthcare provider. Some supplements, like saw palmetto and beta-sitosterol, have shown potential in reducing symptoms of BPH. Zinc, an essential mineral, also supports prostate function and can be included in the diet through pumpkin seeds or taken as a supplement. Maintaining a balanced approach to sexual health is also important. While moderate masturbation may support prostate health through improved circulation and stress relief, excessive or compulsive habits should be managed. Striking a balance that aligns with your physical comfort and emotional well-being ensures that sexual activity remains a positive and health-promoting aspect of your life. Being proactive about self-care and health maintenance empowers older men to take control of their well-being. Engaging in community activities, building strong social connections, and staying intellectually active can also enhance mental health and reduce feelings of isolation, which indirectly benefits physical health as well. Finally, maintaining open communication with healthcare providers fosters a better understanding of personal health needs. Don't hesitate to discuss concerns related to sexual health, urinary changes, or any discomfort. Healthcare professionals are equipped to provide guidance, recommend lifestyle adjustments, or suggest medical interventions when necessary. Balancing these holistic approaches helps ensure that prostate health is maintained through a combination of physical activity, balanced nutrition, stress management, and regular medical evaluations. Taking these proactive steps not only supports prostate function, but also enhances overall quality of life. As you age, living well after 60 means making informed choices that honor your body's needs while adapting to the natural changes that come with aging. By embracing a holistic approach to prostate health, you empower yourself to enjoy life with energy, confidence, and the knowledge that you're taking positive steps to protect your well-being.